Most Medicare Advantage organizations discover RADV exposure during the audit. By then, it is too late to change the documentation. CMS does not audit your coding process. It audits whether the medical records you use to submit HCCs actually support those diagnoses at the required level of specificity. You can have the right HCC code and still lose a RADV Audit plan if the underlying note does not document the condition's current status, clinical basis, and management plan. Annual wellness visits, specialist notes, and retroactive queries. These are the three documentation environments where RADV exposure is most predictable. Most AWV templates capture enough to satisfy quality metrics. They are not designed to document chronic conditions at the specificity CMS requires for risk adjustment. Cardiologists document heart failure. They do not always specify systolic versus diastolic or document that the attending is actively managing it. That gap fails a RADV chart review. CMS is skeptical of addenda added after the fact. Documentation built at the point of care is the only documentation that reliably survives audit scrutiny. The physicians who document your highest acuity members answer to your CMO. The documentation culture that determines RADV exposure is set at the clinical leadership level. Compliance officers respond to exposure. CMOs who own documentation standards as clinical policy prevent it from accumulating in the first place. A concurrent CDI program that queries physicians within 24 to 48 hours of the visit produces documentation that is part of the original record, not an addendum. Physicians who can see their own HCC capture rates and documentation gap patterns change those patterns. Physicians who receive no feedback do not know there is a problem. Compliance departments can recommend. CMOs can make documentation integrity a condition of clinical practice, embedded in onboarding, credentialing, and performance review. Download the blended model readiness snapshot to see where documentation gaps typically concentrate in your contract type and what interventions address them.